Separated?
Yeah, separated.
Okay. Do you change any of the environment or the diet?
So far it's the same.
Everything is the same, huh?
Yeah.
Okay.
So today is August 24, 2016.
How old is your therapy now?
It's about a year old plus.
Year old plus, huh?
Yeah, I guess so also.
You kept for about a year, is it?
I kept about, I think about 1 year.
1 year.
So it should be 1 year plus a bit. It's a male.
This is a Be Kind to Pets veterinary education video sponsored by Toa Payoh Vets, where veterinary medicine and surgery come alive to vet students and pet owners. This video is about penile prolapse in red-eared sliders. Let's now see what exactly is a penile prolapse. So this is the anatomy of a red-eared slider. There's a green shell, a red ear, a green body, a tail, and webbed feet which have long claws for males and short claws for females. The penis is usually in the shell and we usually cannot see it. The red-eared slider you saw at the start of the video is a variation known as the albino caramel variation. At the end of the day, it is still the same species, being a red-eared slider. Next, we see what happens during penile prolapse. Basically, the penis comes out from the shell and we will be able to visibly see it. And sometimes the red-eared slider allows this to happen. And this can be caused by stress, parasites, dehydration, or as a part of a natural process such as preparation for mating. There are also some other possible reasons that this could happen. Usually, in most cases, the penis of the red-eared slider will retract back into its body. And this is a completely natural process, and if this happens, there is absolutely nothing to worry about, and we do not call this penile prolapse. However, in some cases, the penis remains outside for extended periods of time, therefore possibly getting infected, having overexposure, or being damaged by either itself or other red-eared sliders biting or scratching it with their claws. And this causes the penis to become necrotic, which means that tissues die, as well as inflamed. Because of this, the penis is unable to retract back, and we call this situation penile prolapse. Now let's see how we can diagnose a red-eared slider with penile prolapse through physical examination and learning about its history. Firstly, physical examination. So this is the case where we saw at the start of the video, and you can see the cloaca, which is the orifice for the digestive, the reproductive, and the urinary tracts. And the swollen penis can be clearly seen in this video, and we can see that it's significantly larger than the cloaca, preventing it from going back. Next, let's see how knowing the history of a red-eared slider can help us diagnose it with penile prolapse.
The reason why I asked you whether any change in the environment or this is sometimes stress factor affects it. So stress from the environment, noise, pollution.
Not really. Every time is
all the same lah.
for the past few months the same environment.
Okay, no problem.
But eat well lah.
Okay,
Well,
good.
eat
Except today lah.
cannot go back lah.
Okay, Ken.
Now that we understand and have diagnosed the red-eared slider with penile prolapse, what are the treatment options?
Okay, so this one, you know yourself, this one is a penis prolapse. Sorry, this is a penile prolapse. Okay, so basically, usually what we do, right, is we will try to bring down the inflammation and then push it back in. And then we use a purse string suture, means then after that we remove the suture. Okay? Suture means
210 grams.
Oh, okay.
Okay, but the problem now, okay, is you can see it's very inflamed. Okay, so there's a chance that we can't replace it. Okay, means that the hole is so small, but then the penis is so inflamed that we can't push it back in. Okay, so that is one of the issues. Okay, in those scenarios, usually what we might have to do is cut the hole a bit thicker.
And the tail hole.
Yeah.
Okay.
Okay, and then push it back in, and then we stitch that part as well. Okay. It might not be possible due to the inflammation. Okay, so this one we have to give some sedation and then we try to push it in.
This
Understand.
Okay, so
penis.
so now the thing is we can't guarantee you 100% this one.
I know.
Because with penis prolapse, right, usually what happens is if within an hour or within 2 hours the prognosis is very good. Okay, but out of that, right, it means now because yours is 5.
Usually prolapse are just for like
Sure.
Yeah,
15,
exactly.
20.
Then you go back in, you see.
So my helper
5 PM, yeah.
So like 5 PM I thought it was 5 AM, man.
No.
Wow, 5
About
PM.
5 to 6 p.m. I reach home around 7. So I just monitor, hope that you will go back, you know.
Yeah, understand. It might be quite difficult to push it back in then.
Yeah, I
Because
know.
it's been out for very long, so what happens is sometimes the therapy traumatizes it, okay, and also because it's out of its normal environment, okay, there's a lot of inflammation in the penis.
No, I put the water with the antibiotics to prevent.
No, we're not worried about infection, we're worried about inflammation.
I know.
Okay, inflammation is trauma, it's nothing to do with the infection. Okay, but I tell you what, why don't we put some sedation and try first?
I just try first. I mean, yeah.
But and the thing is, I have to let you know that it's not a guaranteed situation because we have some that are so inflamed, right, that they're unable to go in.
Cut off.
Amputation, yeah, one of the
Hoping that
possibilities.
we need 24 hours, as long as the inflammation is not much, we can push it back in.
Okay,
That's the
understand.
problem.
Okay.
Okay, Ken, so you have to put here for half a day. We give you a call after 2,
Sure.
and then I'll let you know whether you can push back, cannot push back, what's the next option, etc.
Okay.
Okay, so like I told you this one, we try our best, but what we'll try to do is, if we can push it back in, that's the best.
Yeah, I know.
If we cannot, we'll try to bring down the inflammation
Yeah.
using a bit of maybe a bit of salt water or what. Then we try to bring down inflammation. Because what happens is when it's out for too long, right, the water content gets a lot. We call it edema, it's just swelling.
Yeah.
So we try to bring down the inflammation. We try to push it back in.
Okay.
Okay, then if you cannot push it back in, we'll give you a call.
Sure.
This is an illustration of the ideal treatment of a radial slider with penile prolapse. Firstly, we see that this radial slider has an inflamed penis. So firstly, what we have to do is to bring down the inflammation so that the penis can fit into the cloaca. So this will allow us to push the penis back into the cloaca and therefore eradicating the problem of penile prolapse. After that, we will also have to stitch the area and stitch up the cloaca. After that, we will also have to stitch up the cloaca to prevent it from coming out. This is an example of another radial slider which is having its cloaca stitched after the operation. Now let us look at the outcome of the operation for this radial slider.
Anesthetic. Okay. Anesthetic.
Anesthetic gas only for about 10 minutes.
Isoflurane, right?
Yeah.
By him.
Try to tickle him.
Tickle will open the mouth.
Yeah. If they get irritated, sometimes you can press here.
So one person tickle, one person open lah. One person give lah direct.
Okay.
So,
Then just push it in.
yeah.
At the
Just,
Now you already fit ready?
no,
not yet.
not yet.
Conclusion. On 23rd August 2016, the radial slider suffered penile prolapse, and 1 day later, it was brought to the vet. We saw a case of an overnight delay, causing us to be unable to push the penis back into the cloaca, and leading to the amputation at the end of the video. Therefore, please do remember to seek early treatment at the first sign of symptoms. For more information, you may email the following address or call the following hotlines, managed by Toa Payoh Vets.